Well, hello everyone, and welcome to the Babies in Common show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. As a reminder, any information shared during the show should not be taken as medical advice. Please consult your own care providers about you and your baby's health and visit babiesincommon.com/disclaimer to read more.
So today is a continuation of our previous episode of Ask Us Anything about baby feeding. And we're going to continue with the questions that we were given by members of our community. In our groups, we asked them to ask some questions, and we got so many questions that we needed to make this a two-parter. So today we're finishing up those questions from, quote unquote, from you.
Yeah, so part one was excellent. So if you haven't already listened to that, after you listen to this one, please check it out because we talked about so many interesting things. But today we're going to start off with a question from a listener about weight gain. So this listener says, I've gotten home with my baby who's about a week old, and the baby is gaining weight, but slowly. And the doctor is seeming concerned. Do you have any advice about a baby that's gaining weight slowly?
Yes. So there's more and more research now that's showing that babies really should be back to their birth weight by 1 week old, which is different than what's being said out there in our medical community. Most of the time it's 2 weeks old, and I would agree that definitely by 2 weeks old they should be back to birth weight, but it's even better if they're back to birth weight by 1 week. And there's a bunch of studies that have been done that are showing that that's more in the normal range. So
even for a breastfeeding baby, not just formula feeding?
Right. Yeah. Yep.
Okay.
Yep. And occasionally I've seen that. It's just as a lactation consultant, we don't see that often because we're usually working with people who are having problems. But every once in a while I have seen it, which is really cool to see. I'm like, oh, you're like a unicorn. Even though it's supposed to be normal. I think because we have so many birth interventions and there's so many factors in birth that go into weight gain and so many pre-existing conditions that people have which may cause their milk to come in slower or at a lower volume.
Sure.
That we're seeing that more now than we did maybe 20 years ago, for sure. So the other thing to think about is frequency of feeding. Some babies are really tired, and so parents are tired. And so sometimes you think you're feeding your baby at least 8 times in a 24-hour period, which it's supposed to be at least 8. But ideally it would be 12.
Right.
10, 12, 14 would be great. And one thing that I've really been battling lately, so to speak, is a lot of people are going, well, I'm doing 15 minutes on each side. There's no evidence for doing 15 minutes on each side. That's an expression that's used frequently with no evidence to back it. And I don't want you doing 15 minutes on each side, each breast, each side of your chest, because it depends on how active your baby is. If your baby's actively suckling, and especially if you're hearing that k sound or the gulp sound and you're like, I'm pretty sure my baby's actually drinking, then great, you can keep them there. But if they start to fall asleep quickly, like so many babies who are slow gainers do, they fall asleep really quickly, and so they don't finish a feeding. Keeping them on there is not going to be helpful. And you can poke them and play with their feet and tickle them, and sometimes that might help them go for a second. But if you're having to constantly do work to keep them awake, why not start breast compressions? So start to squeeze, and you don't squeeze the bigger part of the breast. You start there and then slide with your squeeze and then hold closer to the baby's mouth. And like hold for like a good 10-15 seconds and see, does your baby start to then do those jaw movements that look like they're actually drinking, right? And then maybe move your hand around another part. But if you still are like, but the baby's still falling asleep, yeah, they drank a little bit more when I did that, but they're still kind of asleep, they won't move unless I do that squeeze, then it's time to take the baby off. Maybe you change a diaper, maybe you just get them awake somehow and put them on the other side. Sometimes it's even good to just do like 5 minutes on one side, 3 minutes on the other side, 2 minutes on the other side, 4 minutes on the other side, like random moments where you switch.
Wait, that sounds like every night with all of my babies for the first year of their life.
Yeah, and people are like, yeah, but they're not done with that one. Aren't I supposed to be empty on that side? I'm like, you're feeding your baby like 6 or 8 breaths of feeding now. Like they're going to eventually get the milk, but we're trying to keep them awake so they actually get it. And there's a myth about the hind milk and the fore milk, and that needs to be just.
Ooh, can we bust that myth right now?
Yes.
Yes, please, because that's a big thing. People say you got to keep your baby on the breast long enough, or they're not going to get the hind milk, which is fattier. That's what I was taught.
Right.
Back when I started, a decade and a half ago.
Right. So ultimately, are there certain times that you could see, for example, pumping, when you can actually see your milk come out, that you could see that the first milk you get, that first layer is thinner, and then it gets thicker and thicker, meaning like more yellowish, right? Like
Sure.
more
Or more
yellowish
like,
white.
looks like concentrated. Yeah.
Yeah, sure. But for each person, that's going to be different. For each feeding, that's going to be different. For each breast, it's going to be different. And it depends on how your baby is suckling, too. Some people are going to get that fattier milk out faster. And ultimately, it really doesn't matter as long as your baby's poops are yellow by day 5 and after that,
Hmm.
and they're frequent. So, in a baby under 6 weeks of age, they should be pooping yellow 3 times a day at least. And ideally, that poop should be the size of your palm. Definitely bigger than a quarter, but size of your
Definitely
palm's
bigger
even
than a
better.
quarter, which is like
Yeah.
all the pediatrician usually asks about. I'm like, a quarter's so tiny.
Hmm. Yeah. Yeah, it is. Yeah. So, yeah, they should be pooping yellow at least 3 times a day and gaining weight, right? And if they're
Hmm.
not, then yeah, what's going on with your milk? But it's probably not that they're not getting enough fat. It's more that they're probably just getting not enough volume
Sure.
overall, right? But there's really one cool way you can increase how quickly the milk has a higher concentration of fat. And it's
Ooh,
by
tell us.
doing somebody invented this, we don't know who, but I learned it at a conference where you do what's called the milkshake and you literally just massage the heck out of your breasts and you just
The
and don't hurt yourself.
milkshake. Yeah,
Don't hurt
right.
yourself, don't bruise yourself, but pretty vigorous massaging and shaking of your breast can actually remove mechanically by those manipulations, mechanically move fat globules into the milk faster,
Wow.
right? Really cool. And they've done tests and studies. And actually, one conference I was at last year, 2 years ago, they did this. Somebody actually had a chromatograph machine, which is very
Stop it.
expensive. And they had gotten it like less expensive, but it was like everyone was like, oh, you have one of those, where you take a sample of milk and you put it in this a very tiny sample of milk and you put it in the machine and it shakes it enough to separate the fat, and then you
Sure.
can measure how much fat, like what percentage fat
And
was
did
in that
someone
sample.
actually like lactate?
No, there was tons of lactation consultants at the conference, and so they did it for a lot of people, and it was really fun. They like
That is
on the
amazing.
Facebook group, they're like, "We finally got the results tabulated, and like what the differences of milk were, and yeah."
Ooh, real
So
life research.
yeah, it was fun.
My nerd brain loves that. All
Yeah.
right, so I'm
So.
actually going to go rogue here and ask my own
Mhm.
question because
Mhm.
as a visiting nurse visiting babies on day 3 or 1 week or 2 weeks, 3 weeks, there's this baby, right? There's always this baby that doesn't poop every day,
Mhm.
right? So a lot of people are told by their baby's doctor or provider that it's normal for breastfed babies to not poop every day. And so, what would you say to that, Jeanette?
So that is something that used to be said, and then science proved it wrong.
Ooh, a myth busted.
Another myth busted. So, excuse me. There are close to 1,000 ingredients in breast milk, depending on which scientist you ask. Some will say 400. I think it's closer to 1,000, really. And 230, specifically that number, 230 are called oligosaccharides, and they're a certain type of sugar that are meant to be eaten by bacteria,
Hmm.
then pooped out. They're literally not nutrients for the human. And so
They
pooping,
are helping your healthy gut.
yes, pooping is supposed to happen because those things are supposed to come out. Whereas when I had my first baby 20 years ago, um, it was thought that if your baby wasn't pooping, then they were soaking up all the good nutrients that was in the milk,
Sure, that's what we
right?
hear. Oh, the
Yeah.
breast milk is just so good
Yep.
that babies just use all of it and they
Yep.
don't have to poop. I
And
hear
it's
that
yeah,
like literally
all
once a
the
week.
time. Right. There's definitely people in the medical community that will tell people that absolutely, and it's just wrong, and they just don't know it's wrong. And I think, is that a thing to alarm yourself if your baby's not pooping today? No, but if your baby's not pooping after 3 days, because the gut transit time for a baby really should be within 2 days. I mean, ideally it's every day, but like 2 days, max 70 hours is what I've learned
Hmm.
um, from a wise colleague who studies this more than I do. And so, really, it's like if your baby isn't pooping for 3 days, but they're pretty happy, I'm not going to worry, but I'm going to go, I wonder what's going on there. But if they're going longer than 3 days, really, yeah, what's going on here? What's going
Yeah,
on with their intestinal health, as well as the volume of food they're getting that they're
sure.
not pooping yet? And sometimes they just need more food.
Right. You
Sometimes they
always have to
eat.
make sure the baby's getting enough first before we start thinking about
Yep.
allergies or
Absolutely. Oh,
whatever.
right. Right. Yeah, there's a lot of reasons for that. And there are people that say, "Oh, my doctor told me that babies could go 7 to 10 days without pooping." Okay, well, if your baby's happy for that long, I mean, it's not an emergency, but
Right.
there's clearly nothing that's inappropriate. Something's going on with their gut health. Like, let's investigate that. But if your baby's miserable and they haven't pooped in 3, 4, 5, 6, 7 days, absolutely, this is something we need to look at.
Yes.
And usually, it's feed your baby a lot more and see what happens.
Oh, interesting. So see an IBCLC before you
Yes,
start
please.
eliminating things or
Oh my
brushing it
gosh, so
off
many people
or
are told like, "Oh, take dairy and soy and egg and this and that out of your diet." And absolutely there are some people that I would say the same thing. And
Mhm.
sometimes that does help and you're like, "Great,
Yes.
that helped." But it takes 2 or 3 weeks, sometimes 6 weeks to know whether that is working. And if your baby's miserable for that whole time you're waiting to see if taking dairy and soy out of your diet worked, that's not a great option either. Plus, dairy and soy, I mean, not so much soy, but dairy tastes good.
Right.
And I know intellectually that we should not be eating it. I understand that. I have done times in my life where I have not eaten it, and I did feel better, but it tastes good, so continue to eat it. Um, but I know our bodies do better when we don't have dairy in them, cow milk protein, I should say. But in a situation where a mom or a parent is like having to take a food out and look at every label, like that's
Yes.
hard work when you're trying to feed your baby too and
It's a
exist for the
barrier.
baby.
It's a
So like
barrier to
why
breastfeeding.
stop taking why do dairy if maybe it was another reason your baby was miserable, right?
I agree.
So I like to look at those other issues first.
Seek the help of an IBCLC
Hmm.
before you start eliminating things because
Yes.
sometimes, especially people with limited means, eliminating things
Mm.
like dairy and soy and
Hmm.
eggs can be like all the protein
Hmm.
that they can
Yeah.
get easily, right?
Yep.
And so, it's hard.
Yep.
I agree. Enlist the help of an IBCLC before you start eliminating
Hmm.
things.
Yep.
And all right, so here's an interesting question from one of our listeners. She says, if a baby aspirates at the breast, meaning like I'm guessing choking at the breast,
Hmm.
one side more than the other, is there anything you can do to stop this from occurring? Is it something that we should be super concerned about?
I mean, aspiration is a medical term where milk has gotten into the lungs, correct?
Yes.
And they used to say that if it was breast milk that got into the lungs, that wasn't a big deal. And I think it's definitely not as big of a deal if a baby gets breast milk in their lungs as if they got formula in their lungs,
Right. Meaning
right?
like it's oh gosh, it's like not as caustic to the lung
Yes,
tissue because
right.
it's like
Natural.
its osmolarity
But
is
it still can
similar.
cause some problems, right?
Sure,
But
sure. They're like
typically, right.
choking.
And so, of course, you're going to talk to your baby's doctor about what you're hearing and what you're seeing and making sure that are they actually aspirating or are they just gagging?
Sure.
Or are they coughing and sputtering to normally as a human can, even when we do that? When you get water that goes down the wrong pipe, so to speak,
Sure.
you can recover from that by doing a little coughing and
Right. Are
stuff like
they
that.
actually aspirating something
Right.
into their lungs or are they just
Yes.
coughing, which is a
Right.
reflex to prevent that?
Exactly. Most of the time, it's going to be that they were coughing or gagging. I'll have people say, well, my baby was choking. I'm like, well, choking really means they can't breathe at all. So we need to call that gagging. Unless your baby's turning blue,
Right.
then it's gagging and coughing. And so typically that's because there's such a strong spray of milk that they aren't handling it well. And you're saying one side versus the other too, right?
Hmm.
So then I go, okay, well, if the baby is doing well when they're leaning towards their left, so they're on their left ear, so to speak, then why not switch them to the other side and keep them on their left? So put them in maybe
Oh,
like a side
interesting.
football position where they're on their
Yes.
side.
Mm-hmm.
I don't like the football position where they're looking at the ceiling. The side football, so they're looking across your chest,
Yep.
looking up a little bit at you, but they're mostly looking across the chest and they're on their side. Their nipples are touching your ribs or your boob.
Yes.
And have them nurse there. So they're on the same ear that they did well on the other side. Can they handle the flow on their left side only? But then put them back on their right side and go, oh my gosh, no matter what I do, they cough on their right side. My first reaction to that is going to be, let's take them to a chiropractor or a craniosacral
Okay.
therapist, or at least
Sure.
do a lot of good tummy time and figure out what's going on. Do they have a torticollis? Do they need to see a physical therapist or an occupational therapist or a chiropractor or a craniosacral therapist to work on that one-sided issue? because it's typically going to be that they're tighter on one side. And it's like when you wake up in the morning and you're like, oh, I can't turn my head to the left very well.
Right.
Right? We're adults, so we work out those kinks pretty easily by the time we're driving in the afternoon. We're like, oh, I can turn left now to look,
Hmm.
But babies
But if a
sometimes
baby's like
don't.
only in a car seat, only in
Right.
a bouncy seat, only in a
Yep.
swing, they're
Yep.
not going to be able to do that. So this
Right.
tummy time is super important.
Yeah. Yeah. And we're going to have Michelle Emanuel, the creator of the tummy time method, on next week, actually.
Ooh, I'm super
Ooh,
excited
well,
about that.
depending when we publish this, it might not be actually. We might
True.
have, we probably already would have had her. So go look at the episode with Michelle Emanuel.
That's true.
So sometimes if you don't have access to those care providers or you're not ready to embrace their care, because some people are like, what, a baby chiropractor? That's a whole other conversation.
We should actually have
We should have a
baby
chiropractor. I was just
chiropractor
thinking
on the
that.
show because
Yeah.
there's all right. We won't even get into it, but
Yeah.
it's awesome. Okay.
Really, really helpful. So there's that
So
issue.
is it the breast or is it the baby's side? Is what we're trying to figure out, right?
In that situation? Yep. And then
Yes.
sometimes it's really just the side. Sometimes, sorry, not the side. Sometimes it's the breast is so fast that the baby can't handle it.
Sure.
And the general guideline that I've always heard is that by about a month of age, a baby should be able to handle a strong flow. Right? I mean,
Mhm.
you just said it. You had earlier in the previous episode, you said that Marceline had an issue.
Yes.
Right? And so when you have a lot of milk, some babies, like it takes them a little while to figure out how to handle that.
Yes.
And a baby who has a really good suckle and normal anatomy of their mouth should be able to handle that flow or eventually get good at handling it,
Yes.
right? But again, depending on how their birth went or just kind of even in the position in utero, it may take them a little while to work out and kind of unwind, so to speak. all that.
Anybody listening to this who might be having a baby that sounds similar to this or having issues, I want you to know that as a labor and delivery nurse, things like vacuum extraction,
Mhm.
forceps extraction, pushing for many, many hours, having a baby that's stuck, quote unquote, at a certain dilation for many, many hours, being
Or a baby that was
induced.
pushed out in one push sometimes.
Yes, or exactly, precipitous delivery, a baby that came down very fast, and maybe baby has bruising from a very fast delivery. These are all things that can
C-section
affect
too.
a
Yeah.
C-section. There's a ton of there's a ton of manipulation of the baby's head and neck during a C-section delivery. People think, quote, C-section is going to be gentler than a vaginal delivery. Absolutely not. There's a ton of manipulation to the baby's head and neck with a cesarean. So I'm not saying like be scared about these things.
Right.
I'm just saying like,
Just
if
means
this is something that
get
was
more
part of your
care.
birth experience,
Yeah.
seek out more care.
Faster.
Maybe exactly faster. Don't wait. Don't wait.
Yeah. Yeah, absolutely. And the other thing I'll say is that sometimes the reason the baby can't handle a flow and they're gagging and coughing is because they don't have normal anatomy and they have an oral restriction
Sure.
or they have a function issue. And that goes back to sometimes there are times where it looks like and feels like the baby might have a restriction that might be diagnosed by someone else who's allowed to diagnose a tongue tie. It's so funny because in other countries that they don't have this whole diagnosis.
Oh, it's so
thing.
ridiculous. Yeah.
So some of my
I once
colleagues
had
in
a
other
doctor,
countries-
Jeanette. I once had a doctor tell me a patient that was literally bleeding onto the floor, like making a puddle of blood onto the floor.
You
after
weren't allowed to
delivery.
say it was hemorrhage.
I wasn't allowed to say it was hemorrhage.
She's bleeding a whole lot, doctor.
I was like, I think, like, objectively speaking, this patient is hemorrhaging. I don't think that's outside of my scope of practice.
I
No,
think
you're
the
totally
famous
right.
story I've always heard about nurses is that even if the bone is sticking out of the body, you're not allowed to tell the doctor it's broken.
Absolutely, yes. It's so
Right?
it's so effed up.
Anyway, yeah. So, where was I going with that? Oh, because sometimes when they can't handle the flow, it's a restriction. And so sometimes it's a tongue tie.
Yep.
And sometimes it's a function that they've got an issue with all the facial and head muscles that are attached to the tongue, of which there are many, that those are not working well together. So the tongue is not restricted or tied. It's just not functioning right yet.
Sure, like
so-
laryngomalacia or something like that. Like a weakness of the throat or
Sometimes that's more of like a swallowing sound, but it could be like
Okay.
coughing too, sure.
Sure. Okay.
But yeah, I mean, sort of looking at the whole picture
Right.
and seeing, is there something we could do? Like I have learned some really cool, like facial and oral activities, so to speak, that parents can do with their baby multiple times a day that may help the baby start to coordinate that better. And if
So
that doesn't all
so many
work, then
tools in
there's
our
other
toolbox.
people that I can refer to get even more intense with it. So,
Mm-hmm.
yeah.
All right, let's shift to baby feeding products or all right.
Yes.
So one of our listeners said, what type of cover do you recommend for pumping in the car? So first of all, I'm gonna like backtrack and say, like,
Yeah.
people pump in the car? I know I did, but I want you to people might be like, what do you mean pump in the car?
Mhm. Yeah. So I always have to give a caveat, disclaimer, or warning, I guess, not quite a disclaimer, more of a warning that like it's probably more dangerous to pump in the car if you were to get in an accident. It should never be a distraction.
Yes.
You set it up, you start it up before you're driving.
Yes,
You
absolutely.
do
Do
not
not be
check,
like hooking up the
no,
pump while you're like
do not like maybe you turn on and off the machine while you're driving, like you might like grab a tissue. Okay, fine, but
right.
do not let it be a distraction. Do not be looking at how much milk you got. Don't be trying to unhook things. No way in any way. However, if you were to have an accident, God forbid, I would venture to guess that there would be more damage because you had a pump on your body,
Sure.
right? So either I think the pump parts could break the airbag, rendering it useless and then causing you more harm, or perhaps the airbag itself could cause more harm to you because they would be pushing those parts into your body more, right? So I think
Possibly,
we have
yes.
to, like, if you're gonna pump in the car, you have to go, okay, I'm willing to take this risk.
Right.
I know this is a thing.
Yes.
So that's sort of my warning about that. Otherwise, I think any blanket, nursing cover could work. There are people who've told me like, "Yep, I noticed the trucker was looking down to see what I was doing," you know. um, I think it's not that hard. There's videos all over YouTube about how to do it. There's people who have like, here's how I set it up, and then I put my seatbelt this way, and this is what I use. Having a pumping bra is really, really
Yes,
important.
you have to have a pumping bra.
Absolutely.
Oh my God, please
You're
don't
not
try to
holding.
pump.
Do not hold the parts. Yeah. And I think even too, like if you're using one of those silicone milk catchers instead of a pump, which one would venture to think in common sense would be safer if you were in an accident, right? But not everybody lets down milk well to those silicone things.
Sure.
But if you had one of those silicone things on, or maybe two, there's a famous picture of Chrissy Teigen who was using two of those in the car
yeah,
once.
she's
Yeah,
awesome.
yeah.
She's so right out there with everything.
Yeah. And I think having a pumping bra on while using that is still really important
Because they can
because
like lose suction and then you
they
spill
can.
all over yourself.
And
That's
then
happened
you
to
will
me.
be distracted because anybody who loses milk is going to be like, oh no! And in that moment, you didn't mean to lose control of your car, but you probably will. So use a pumping bra no matter what you do, to be sure. Yeah,
I
so
agree
that's
100%.
quick answer. It's a quick answer on that one. But I think people who are pumping a lot or have a long commute, that becomes something that they do. You know.
No, that was one of the only ways that I could actually pump and maintain my milk supply when I was away from my third baby was I had a short commute. And so I would hook up my pump in the driveway. I'd press start. I'd drive to work, listen to a podcast, listen to the radio.
Mm-hmm.
When I'd get halfway to work, I would pull over into this Chinese food restaurant that was exactly 15 minutes from my house. I would disconnect, take care of my milk, and I would be on my way. And that was, something that helped me because as a nurse, I didn't always get a chance to pump multiple times during a shift, maybe only once. We actually did a whole other episode on this.
Despite the law protecting your right to do that.
Despite the law
It's
protecting
not
your right to doing
something
this,
that
yes.
medical providers are often allowed to do, which is why we have a whole Facebook group called Medical Workers with Pumping in Common. And then teachers is another group. So we have teachers with Teachers with Pumping in Common is another Facebook group because they're another group that should be legally able to pump regularly, but because of their job doesn't really help. It's hard to do that.
And we did a whole episode on this, episode 26, going back to work and pumping at work. We talked
I love how you always have our list of everything in front of you.
Listen, I am obsessed with our podcast, okay?
And that's what people should be listening to. If they're pumping in the car, you should be listening to our show.
100%. I mean, there's so many good episodes. I always tell people when I teach childbirth class that our podcast is like a continuation of our classes on all the things we wish we could like just talk about for an hour.
Right.
It's like, it's that, right? So episode 26 was going back to work and pumping at work. And we interviewed a nurse and also my sister who is in the corporate world, right? So, and how that worked and what they did to make it work. So yeah, I mean, pumping in the car was something that helped me continue my breastfeeding relationship after going to work with my third. But I agree. I mean, I obviously was taking risks by like pumping in the car. God forbid I got into an accident. I didn't, but I agree. You can't just be like, you know, like trying to maneuver things while you're driving. I
Right.
hooked up, started my
Yes.
car, drove, then I pulled over and took care of the
Yes.
milk.
Yes.
All right. Here's another question. It's about pacifiers. This is
Mhm.
another big one when I teach new baby ready. What pacifiers are better for nursing babies? So I would actually say not just nursing babies, but any baby.
Yep.
You know, there because you know there are some pacifiers that they claim to be quote orthopedic, right? There's this
Orthodontic.
huge-
Orthodontic.
orthodontic,
Yes.
yeah, orthopedic.
Orthopedic would be magical, right? Like, this will help your baby
Oh my
walk.
god, yeah. Okay, not or clearly I am a a nurse
Tired
that has
mom
to
of
wear
3.
a tired mom of 3 who actually does wear orthopedic shoes. My back, I'm 14 years as a nurse.
Yes.
Okay, so orthodontic pacifiers. This is like go down the aisle of Target and you'll see
Right.
40%
And they
of
don't
the
even have
pacifiers.
teeth yet, and they're using those.
Orthodontic pacifiers,
Because
I understand. So what pacifiers
Orthodontists
are
know about breastfeeding. I don't
no, clearly they don't.
know.
What pacifiers are better for babies?
So, in an ideal world, a baby wouldn't take a pacifier because their tongue would naturally press against their palate when their mouth was closed, which would soothe them, stimulate their brain, and help them sleep and calm down, which is the way that humans and all mammals were designed. Our tongues are supposed to be on our palates.
Like right now, think
Because-
about it. Where's your tongue?
Close your mouth, right?
On your
If it's
palate.
not on your palate, then maybe you should see a specialized dentist to see what's going on with your mouth, because you're probably a mouth breather, you might be a snorer, and that gives you lifelong risks as well. So
Ooh, interesting.
yeah, that's
That
a
is
whole other
very
issue on
interesting.
airway and tongues. So yes. So
But what if your baby's like my daughter
yeah,
Marceline?
I know, really wants a pacifier.
Really? I actually had a baby with our home birth this summer that was born with 2 huge suck blisters on each of his little hands. I mean, it was not a superficial blister. It was many layers
I
of
want to
skin.
see pictures.
Yeah, and so both hands, both right near
Wow.
the thumb. And so we
See,
were
then
like,
that
wow.
baby clearly didn't need a pacifier.
Well, that baby clearly had an oral fixation.
Yes.
So we were like,
Yeah.
you know, maybe we were just like, hey, throwing it out there. Like if this baby just won't ever settle down and you know they've had enough and they're peeing and pooping, all these things, maybe if you introduce a pacifier, this would be the one to do. So so what would you recommend?
So we want to, if your baby needs a pacifier, and again, I love what you said, like it's not just about breastfeeding babies, any baby, you want to think about, and I'll even bring bottles into this. I know that was a question that people had as well. You want to ignore all the marketing materials.
Just
There's
ignore it.
so many companies that'll say prevents colic, perfect for nursing babies, or
Helps you switch
whatever.
from breast to bottle better.
No. So you want to make sure that whatever artificial teat that you are using has a more gradual slope to it, and definitely has like a longer nipple with a wider base. Now, I don't mean your typical wide base bottle, because those have what's called shoulders,
Yes, it's
where like the nipple's the head.
like
Yep. And then you have like
You're-
shoulders.
it's like a
And-
straight nipple down, then
Yes.
it goes out to the side,
Yep.
and then it's like, yeah.
Yep. And that is going to encourage a baby to just slide right to the nipple and clamp on the
Yes,
nipple.
yes.
And I don't care whether you're not breastfeeding or not. I mean, if you're not breastfeeding, it still doesn't matter. Your baby should be suckling in a way that's optimal for oral development.
Yes, exactly.
And the way the tongue moves affects your brain development too. It's
And
not
your
just
speech
about
and
eating.
everything.
Yes. And it affects your palate and how your palate spreads to be able to fit your teeth. So
Yes.
for a lot of kids, you know, you look at that and you're like, chances are pretty good this kid's going to end up needing braces. Now, I have not done a study on this myself. I have not seen studies where they've followed kids like that. It's just, if you just think your common sense, that baby who needs a pacifier that badly might have a palate that's really thin and narrow and high because the tongue was never raised up against it, oftentimes because they have a tongue tie.
Interesting.
And those kids are likely, given all the dentists that are friends and colleagues that I've worked with over the years, that they're more likely to need dental work because they don't have enough room for their teeth, right? So we really
Side
want to
note,
choose a pacifier. Yeah.
total side note,
Mm.
there is some research to show that babies who had to be intubated
Mm-hmm.
for long periods of time in the premature babies can sometimes have different
Mm-hmm.
like development of their
Yeah.
palates as well.
Yep.
So that's something, if you had a preemie baby,
Mm-hmm.
being super, what's the word I'm looking for? Super cognizant of their pacifier use. Because, a lot of babies are given pacifiers in
Yeah.
the NICU
Yeah.
because it,
Yeah.
stimulates them to suck and
Mm-hmm.
reduces incidence of issues and
Yeah.
whatnot. So yeah, I mean, if you had a NICU baby, that's
Yeah, because
something.
sometimes
Okay,
there
so
are reasons why pacifiers would be
yeah.
helpful.
So
Yeah.
if you're choosing a pacifier, we
Yes.
will recommend not shoulders for a bottle or a pacifier.
Yep. Yep. So there's very few, and not the
Mhm.
orthodontic one, not any one that's like crooked or zigzaggy. You don't want one where the lips meet and it's really thin,
Yeah, like it
right?
looks like you don't want the pacifier to look like the way you don't want your nipple to look
Yeah.
after a baby sucks
You
on
want your
it.
baby's mouth to be really wide, like they're yawning, to latch. So the last thing you want is to have a pacifier where they're doing the exact opposite with their mouth.
Yes, correct.
Their lips are tight and pursed, and then the nipple of the pacifier or the bottle is a weird shape
Right.
that's flat or it's zigzaggy, right? We
Because what
don't
you're
want that.
talking about is this resting of the tongue on the palate. Some of these crazy nipples that look really pinched and then have this bulbous nipple that might
Mm-hmm.
stimulate the palate, that might
Mm-hmm.
soothe the baby. Maybe
Mm-hmm.
that's why those pacifiers are well
Mm-hmm.
selling, right,
Right.
are good sellers.
Right.
But that's not going to be good for the baby's oral development. That's
Right.
not going to be good for the baby to transition from breast to bottle. That's not going to be good for the baby's
Right.
palate.
So when I see a baby, and typically it would be a baby who's got a tongue tie and a high palate, and the parent says to me the only pacifier they can keep in is one of the ones I just said that we don't want to
Right.
have any baby on,
Yeah, the pinched one with the big
right?
bulbous tip. Yep.
Yeah. Or the crooked, like zigzaggy one,
Yeah, the crooked
flattened one. Like, and I'm like, well, and then I show them or we talk about the pacifiers that we would prefer if they're going to have a pacifier. They're like, oh, they can't even hold that one in their mouth. Pops right out. Like, that's a clue to me. Like, I don't need a baby to
Yes.
take a pacifier, but if they can't take a pacifier that would be the ones that we would recommend, that's an issue. But I just actually had this situation the other day. I was like, tongue-tied baby. I forget how old the baby was. Doesn't matter. But I was like, listen, I'm not saying don't use this pacifier ever again. Like, try to not use it as often because they were using one that the baby could keep in that was not a recommended
Of
type.
course, right.
And again, not all babies need pacifiers. In an ideal world, they wouldn't all have them. But pacifiers are a thing. So I was like, if you need to use this, try to use it less. But if you decide to have your baby's tongue released, because we had talked about how tight it was and it was attached almost to the tip, and I was like, then I would love you to not use this at all after that release,
Sure.
right? So you're going to try and get off of this pacifier. But for right now, if this is the only one and you're in the car and the baby's screaming and this is what's going to calm you down,
Right.
there's a time and a place, I think. And I've got colleagues that are so anti-pacifier, and I understand where they're coming from. But I think as a parent,
Yes.
sometimes pacifiers help you live a more relaxed
Help
life.
you
And
live.
so
They help you live sometimes.
choosing one that helps your baby's development and using it rarely
Mhm.
is going to be a better idea. And bottle shape is really so important. I would say, I've been saying this lately, I kind of did some research. I own many, 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 many bottles.
And you actually take them out for your breastfeeding ready class. I mean, like you
Yeah.
bring out pumps, you bring out bottles, and I know
Well,
as an
the in-person, I do
IBCLC.
that less now for the virtual one
Oh, that's
because
true.
of time. It's just with virtual, it's interesting. It takes up time in a different way.
It
You
does.
can't just have everything on a table, right?
It's
like-
true.
And like point to things real quick, which you could do in the other class in person, but we'll get back to that someday. So yeah, I probably own like 35 types of bottles, and there's probably 5 that me and any IBCLC that knows anything about bottles would like.
Yeah.
And there's
So-
even like my top favorite 4 are 3 of them are very similar in that they're sloped, right?
Mhm.
Like almost
Like a
mountain,
triangle, like a
triangle-ish.
mountain.
Yep.
Exactly. Yep.
And then one of them is longer with a bigger place where the lips land,
Got it.
right? So it's wider at the bottom, but the whole mouth still fits over that. And I think that's the other piece is that you want as much of that teat in their mouth as possible.
Because you want not just the nipple, but much of
Yeah,
the breast
right.
in their mouth.
And
So
that's
again,
'cause
even
it's
if your
called
baby is
breastfeeding.
never going to breastfeed,
Right.
what is developmentally appropriate for a baby is
Mm-hmm.
to feed at the breast.
Mm-hmm.
Even if your baby is never going to feed at a breast, you want
Mm-hmm.
them to have the developmentally appropriate teat in their mouth that
Right.
helps them develop in the way that a breast would, right? So
Right.
it's not that, nobody's anti, bottle feeding, bottle feed. All three of my kids had to bottle feed. I had to go to
Mm-hmm.
work. But I
And the
want
way that
to,
you bottle feed too is no longer, we don't want to lean a baby back.
mm,
I mean, in a rare instance for a baby who can't transfer any milk because of issues, of course, sometimes we're going to do that. But for the majority of babies, we want to make
typical
sure
baby,
that
gaining
that
weight,
bottle is
healthy.
level to the ground and the baby is either laying on their side with formula, that's less recommended, but upright, very, very upright,
Hmm.
with the back of their head free to scoot a little bit back so their chin's a bit away from their chest. And then the bottle is level to the ground and the nipple only has maybe a third to a half full.
This is called
And
paced bottle feeding,
it's
right?
one version of paced bottle feeding. I've
Okay.
heard of other paced bottle feeding where you actually take the bottle out of their mouth once in a while, which I
Mm.
totally disagree with. We don't want to do that.
Oh, see, I'm not thinking about that at all.
Yeah,
So if that's what they're recommending, that's not what
right.
we're
We don't
talking
want to do
about.
that. So this type of paste, it's like baby-led paste feeding, sort of a
Got it.
combo
Okay.
word.
It allows the baby
Where,
to suckle to get the milk, not just pour
yes.
it down their throat.
And I would even say start with no milk in the nipple. Let them suckle 7 to 10 times. Unless you know that your breasts like spray like a hose right away, then your baby's used to getting milk right away at the breast,
But
right?
what if they get air, Jeanette? Won't that cause them to
I
never
know,
get into
right?
college?
No. Into college. I love that. I know that's the worry of every parent because they know their
What if they
parents are
get
going to say
air?
something.
Right. Their
No.
parents are going to say something.
Yeah, where they get air is back in the traditional position where the
Yeah.
baby is just getting a flow. And slow flow, there's no standard in the bottle feeding industry for what that means. So if you point a bottle towards the ground on an incline, right? And the
Yep.
baby is drinking that because they're underneath it because they're
Hmm.
reclined back themselves, then they have to gulp, 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 and so they're going to get extra air. But it doesn't seem to be a problem for, I think there's maybe one person that said they seem to think their baby was getting extra air, but sometimes there's other issues with the swallow. It's not necessarily the way the bottle's working. It's that the baby has other issues with their tongue and swallow, and that
And babies can
brings air.
burp, either on their own or
And
sometimes
not
other
all babies
people.
need to burp either,
And
right?
not all
But
babies
some
need to burp.
do.
But many times they
Yes.
just go burp.
They do it on their own. Yeah, and so you just want to kind of, and if the baby's like suckling really, really fast, then you can lower the bottle so there's no milk in
Sure.
the nipple again or less milk. And a good, like if you're doing a full feeding for a baby, it should take about 5 minutes per ounce.
Okay.
Maybe even a little longer than that. Because you don't want them to think, well, the bottle, I get it so fast, so, oh, I don't want to have the breast. But also, could we bottle feed in the restaurant? Like with the baby's cheek on the
Mm.
boob, or especially if it's human milk in the bottle, you could lay the baby down in that side football position or even in a position in front of you like cross cradle and hold the bottle next to your breast. So when they're looking at you, they're like, "Oh, I'm in the restaurant. I see the boob." Like they're used to this is where I get fed. So that transition back to the breast is going to be much more streamlined.
Interesting. All right. Speaking about bottle feeding,
Mhm.
this Babies and Common Parent writes, I know you can refreeze breast milk if there's even one frozen crystal left in it, but is it okay to defrost and refreeze more than once? I have a stash of bags that are only 5 to 6 ounces, but I only need about 2 ounces to defrost for my baby per day. I'm just wondering if it's okay to partially defrost and refreeze multiple times. What do you
If
say,
you're,
Jeanette?
I would say if you're partially defrosting, pouring off the liquid, feeding that to baby, and then freezing the stuff that's still frozen, yes. Whether you could melt it with some frozen still in the bag and then refreeze it more than once, I don't know that there's research on that.
Yeah,
Probably, I mean, it's pretty hard to make breast milk go bad, really, when it comes down to it.
right.
Probably. I just don't know that there's any evidence that people have studied that. But the chances of bacterial growth in very cold milk that is partially defrosted but is still in a bag with frozen milk, right? It's like
Mm-hmm.
melty, but there's still ice milk in the middle.
Sure, like ice
That's
crystals.
still so cold. So I think the risk, most people are worried about the risk of bacterial overgrowth. So the likelihood that would happen in that instance would be so tiny,
This is so not scientific,
right?
but I would
Like,
agree with that.
you know?
My question is then, is there a concern that the babies, like I know that, there's like when you let a bottle of milk in your fridge settle, right? Like it's going to be the fat at the top and the cream at the top, right? Is there a risk that like you're only giving the baby like a skim milk, right? If you're only partially defrosting it because you're not, mixing all of it together. I suppose if it's a once in a while type of thing, it's not really going to probably be that big of a deal for
giving
feeding.
your baby fresh milk is always the best thing.
Totally.
Right?
Yes. From the tap or pumped and fresh.
Yeah. Ideally, you're not 100% feeding a baby frozen milk.
Right.
Then again, people who are using all donor milk might have to be doing that, right?
Right. Yes. And that would be fine. Dr. Jack Newman, he from a very famous pediatrician from Toronto, Canada, talks about, he gets a lot of questions about, is it okay if I'm feeding my baby donor milk and my baby is 3 months old, do I have to find 3-month-old pumped donor milk, right? Like from a baby that was 3 months old and that person pumped that milk. And he says, this is something that's perpetuated by the formula industry because formula never changes, right? It's always the same. That's why you have to give more and more formula to a growing baby, whereas a breastfed baby,
which there's actually debates about that too.
Interesting. We can talk about that in another episode. But a breastfed baby generally, even for the first year of life, is going to take 3 to 5 ounces per feeding because the milk changes, right? So, okay, yes. Would it be, I suppose, 100% better to have like 3-month-old milk for 3-month-old baby? Sure. But also like any breast milk is going to have benefits over formula, which is always the same. So don't say, oh, I can't give my baby this 9-month-old milk because my baby's only 3 months old. Breast milk still has benefits, right? But I have had many over the years, like patients or friends that, because of the convenience of, well, I just pump and throw it directly in the freezer and I always give my baby the frozen milk. I'm like, I mean, I'm not saying that's bad because again, breast milk is always going to be better than the alternative, which is formula. Not to say that formula is bad. I'm just saying if you are pumping milk, that's going to be better than formula. Okay.
Because you're going to go to.
Well, no, I was just saying, but fresh is always better, right?
But why is it better?
Because it has so many immuno properties to it, right? Like antibodies and living cells. I mean, breast milk is alive.
And when you freeze it, some of that goes away.
Some of that goes away. And that's fine because breast milk is still always going to have so many more benefits than artificial cow's milk based baby formula.
But also what you're encountering that day or the day before, your body is making antibodies to that specific thing. So if you are going out and about in society with your baby, then you could be giving your baby specific protection against something they might encounter
that week, that day,
because you already made antibodies to it.
Yes. So please don't freeze your fresh milk and then give your baby 3-month-old frozen milk if you have fresh milk to give. If you only have frozen milk to give because it's donor milk or because you have stopped lactating and you are just using up your freezer stash, please know that that is a wonderful gift to the baby.
Yes.
But if you have fresh milk, for the love of please
give
your baby that fresh milk. So what I would do is I would pump and then I would take that pumped milk and I would put it in bottles and I would leave it in the fridge to be given to the daycare provider or my husband for the baby that next day. Any milk that the baby didn't eat that day, my husband or the daycare provider would put aside and I would freeze it. Right. And so if, let's say, God forbid, oh God, I can remember every one of the times that I accidentally forgot my bag of pumped milk in the car. And, I just, for whatever reason, I completely forgot about it and it was just not usable. I'm glad I had that frozen stash, right? Or if I didn't pump enough that day for the baby to eat, I'm glad I had an extra bag or two in the freezer to supplement. But please don't just freeze your fresh milk. That is so good for the baby, like you said.
And another myth that we can dispel. Some people are hearing that you can't shake milk. You know, when you refrigerate it and it separates,
I totally heard that. I was
right?
taught that. I heard
Yeah.
that. Never. I remember typing to my daycare provider for my first baby, please don't shake breast milk. It breaks up the proteins.
Right? Just swirl it. You're like, humans
Just
are not
swirl
strong
it.
enough to break down a protein,
Yeah, right?
right? So you
So
can
that's
shake
a
the
big
heck out of
myth?
it. Yeah, you can shake the heck out of breast milk.
Make it like
Absolutely.
a Polaroid picture. That's what I say.
Mhm.
Whatever you got to do. Because people are like, I can't get all the fat off the bottle if I don't shake it. What do I do?
You shake it. You can warm the exterior of the bottle up a little bit
Yep.
too, and you
Run
can
that
shake it
bottle
then.
under hot water and
Yeah,
shake it like a
absolutely.
Polaroid picture. There you go. Okay. Here is another one. Ooh, this is a big one. This was a huge post on the Babies in Common Breast Milk and Conversation page. Okay. One of our parents wrote, what is the best way to introduce solid foods to a 4-month-old baby? That's a loaded question. Jeanette.
It's a really simple answer.
What is the best way to introduce solid foods to a 4-month-old baby that can't sit up on their own?
The answer is not to. It is not
What?
appropriate.
But
It
my
is-
grandmother told me to start giving the baby
And
rice
your
cereal.
pediatrician may have told you to. Nope, it is not appropriate to give solid foods to a 4-month-old. We are supposed to be waiting until around 6 months. And your baby can sit up on their own. Not to say they have to sit up individually and not fall over ever, but they need to be able to sit in some sort of chair, not one of those seats that traps them either. I'll leave it unnamed. But like if you're going to put your baby in a high chair or you're going to sit them on your lap to feed them, they shouldn't be slumping over. They should have enough core strength to be able to sit and hold their head up. They should be able to have something in their mouth and not gag all the time. Like if they have a really
Yes.
strong thrust and gag, then they're not ready for food. Some would even go so far as to say they need to have a tooth, but there are some kids that get teeth really, really late. So
I have a friend whose baby did not get teeth until 12 months old. And I was like, you have a different parenting relationship with your baby than I do. Because my oldest started getting teeth at 4 months old.
Yeah. Yeah, and there's a lot of American recommendations out there in the medical world saying introduce foods between 4 and 6 months. And that has been not recommended for about 20 years now.
Yeah.
It's really been globally, all the research in infant feeding has been 6 months and above. And there are some babies who are not ready to eat solids until 7 or 8 or 9 months.
Mm-hmm.
I think the general consensus is that like by around 8 or 9 months, they should be starting to do that because building skills for not only moving food around in your mouth, but also using your hands to bring food to your mouth, that's an important milestone to have. Do we need to introduce purees? Absolutely not. Are purees a normal thing that kids can eat? Absolutely. Adults eat purees sometimes.
Yeah. Sometimes I
Right?
have yogurt.
So there's baby-led weaning, which is a movement. It's a book. It's lovely. It's wonderful. I adore it. It doesn't mean you can't ever give your baby a puree, but we don't need to start with a puree. And I think there's a lot of wonderful evidence for not starting with purees. Also, cereals. The idea that we would need to go to a store and buy a processed food in a box to be our baby's first food is preposterous.
Yeah. It
Absolutely
is
not.
all marketing. It is
Absolutely
all how
not.
do I increase my market share
Yep.
to sell my product.
And they say, oh, but it's iron fortified. There are other ways your baby can get iron, and not all babies at 6 months need iron. I mean, it's generally recommended, but we can also, depends on how things have been going for their life and what foods you're going to feed them.
And
There's
also,
other factors.
side note, breast milk has more absorbable iron than
Yes.
formula. And side note,
Right.
delayed cord clamping, or also known
Yes.
as appropriately timed cord clamping, also
Yes.
increases your baby's iron stores.
Exactly.
But that is for another.
Yes. That's why I say
Actually-
it depends on what their life was like.
Yeah, Amy Brown,
Mhm.
episode 22. I know you're
Yep.
always making fun of me about this, but episode 22 is what influences how we feed our babies with
Mhm.
Professor Amy Brown from
Mm.
England. And she talked a lot about
From Wales, she'll
introducing-
tell you.
from Wales. Yes, you're right. The introduction of solid foods. And we talked about this in that podcast that, back in like 1890, the average age of introducing solid foods was 11 months. And by 1950, okay, prepare to be completely blown away. Because of Gerber, right, manufacturing baby foods, trying to increase their market share, the average age that they were pushing for babies to be fed solid foods was between 4 and 6 weeks
Mhm.
of age. Okay. Can you imagine giving your 1-month-old baby?
I remember when I had my first baby, and I remember we were at a party at a friend's house, and I I think my baby was 6 weeks old or something, but I already had a master's degree in public health, which focused on infant and breastfeeding nutrition. And I knew enough about baby nutrition. And this woman tells me that, oh, she put cereal in her baby's bottle starting at 3 weeks. And that's what her pediatrician told her to do. And her kids were like, I don't know, 5 or 8 years older than mine. So it had been a little while. But like, that's what she was saying was normal. But it hadn't been that long ago. It wasn't like 30 years ago.
Yeah.
It was relatively recent. And I was just like, I got to keep my mouth shut, like, that's not appropriate. And there's still a lot of grandparents that'll say that, like, oh, just put cereal in their bottle and just make the nipple bigger. No, 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 no. There are actual there are things that happen to the baby's gut that are not healthy, and that goes on to lead to inflammatory gut response and leaky gut and all sorts of allergies, and it's just not a good idea. So you want to introduce whole foods, ideally in a way that the baby can hold them in their hand and not on them. And of course, you're going to watch them for choking. You're not going to leave them alone. But, reading a book, joining some websites, there's some really great resources on baby-led weaning. And
More
yes,
Milk
of course,
Mamas group, which you
the More
lead,
Milk Mamas
is
group, yep,
a lot of
helpful.
it's geared towards people who are breastfeeding a baby 6 months of age and older. So
Mm-hmm,
I learned a lot from that group, just from the other parents
right,
there.
right. Yeah.
And I
we
know,
talk in
again,
the Amy Brown episode, we talk a little bit more about other resources for that too. Yeah.
you're going to make fun of me, but it's show 16 and 17 with Teresa, the sleep expert.
Right.
Teresa
Yeah,
Stewart.
good points. I know what you're going to say.
She talked about the myth of introducing solids as a way to help
Yeah.
your baby sleep, and she busts that myth in those two episodes, 16 and 17 of our podcast, because there's nothing related to the circadian rhythm when it comes to introducing solids.
Mm-hmm.
We could also get into how rice cereal is devoid of nutrients and full of arsenic, but we have to continue, Jeanette. So speaking about nutritional benefits.
Yes.
Another question from a listener, and I have heard this more often than I wish to admit. It makes me cry inside. My pediatrician told me to stop breastfeeding after 12 months of age because my milk no longer had nutritional benefits. Right? What do you think about that? I can't even say it without laughing.
I know. It's amazing.
Ah!
But they will encourage you to feed your baby water.
Or devoid of nutrient rice cereal.
Right.
You're like cruising towards a year and your baby turns a year and it's like, ding, your milk no longer has nutritional benefit. Please introduce cow's milk in your baby's diet.
Oh my God, we could make the funniest Pixar movie about that.
All right, so is that true? Does your milk
Not
just
at all.
completely lose all nutritional benefit after a year?
It changes based on your baby's age. So milk that is for a 2-year-old is more concentrated, and it has ingredients in ratios that are more important for the growth of the 2-year-old brain, as well as their body, mostly their brain. And it's just different than the milk that's needed for a baby that was born at 36 weeks or a baby that is now 3 months old. It changes all the time. It changes throughout the day, changes hour by hour, but it also changes based on your baby's age. Absolutely. And it does not ever get devoid of any nutrients whatsoever.
And you know what? Even let's say it was devoid of calories, which is just not true. It's a mammal milk, so it's got calories. But it has, again, immune benefits to it, right? So there is a lot of research in immunology that talks about how the human person, the human baby, takes about 2 years to mature an immune system, right?
And the immune system is matured in the gut.
Yes, exactly. And so you continuing to provide your baby with your milk until the age of 2, which is what the World Health Organization recommends, if that's mutually desired by both parent and baby, of course, still continues to provide antibodies and immune benefits to your 2-year-old or beyond, right? So it doesn't have to be that it's as equivalent to a turkey sandwich, right? Like my daughter Marceline eats a lot of regular food. She eats more food at 15 months than honestly my 4-year-old does. She's like a house, and she's tiny. It's so funny. But she still nurses 3-4 times a day. And I know that if she ever got sick, she'd get that milk to help her get better. And I know that it's helping protect her from all the things that I'm exposed
Hmm.
to. And so, it's great that she still has that nursing relationship with me. It's not the main source of her calories. It's not
Although
supposed to
there's
be.
some kids who are older who do nurse many, many times a day.
That was my first. He
Yep.
still nursed like a
Yep.
newborn.
Yep.
No matter what I did. And guess what? He is a strapping young 7-year-old who has
Hmm.
met all his physical and emotional and mental
Yeah.
milestones. And yeah, I mean, he just was a booby baby. I don't know.
But they
I think
also like are recommending that you stop at 1 year and then introduce what? Cow's milk.
cow's milk,
So
right?
another
Another
mammal's
mammal
milk.
milk.
When you have milk that's literally made for human babies, your specific human baby as well. And one really cool fun fact about breastfeeding that I heard at a conference by a doctor who is a researcher. He studies human milk. He had another cool title, but I think he might have been a neurology expert as well. And I wish I could remember. It doesn't matter. So, really cool doctor who'd done a lot of research, and he said that in his research, along with some other people he was working with, they discovered that the longer someone breastfeeds, the closer the baby's DNA is to the parent.
Ooh, interesting.
Yeah. And you know what's sad? I said that to a mom once, and she said, "Oh, I don't want my baby to be more like me." I was like, "Oh, honey." Like,
Oh.
I didn't say honey. I never call anybody honey. I did not call her honey. But like,
But in your
but
heart,
like,
you said,
you
"Oh,
know, I'm like,
honey."
oh dear, like, come on, like, no, like, that's amazing, right? Like, they become more like you in their DNA. That's really cool. So there's more passing on than just nutrition for sure. There's also
Oh
DNA.
my gosh, we can't even get into epigenetics. It's
Mm-hmm.
fascinating. It's
Really important
fascinating.
stuff.
All right, here is our last question,
Okay.
Jeanette. All right, you ready for it?
Mm-hmm.
What's the scoop on offering water? How much and how often should I be offering water to my, let's say, 7 to 12-month-old baby? My infant that is eating
Sure.
complementary foods, but is also still nursing. How often should I be offering water?
So babies in the first year of life do not need any water. They're they do not need any water.
You're
So
blowing
that
my
being
mind, Jeanette.
said, if your baby is eating food, so they're more than 6 months old, and typically they'd be eating enough food, so more close to like 8 months old,
Mm-hmm.
where they're eating enough food that maybe they're getting a little bit of constipation, you could just give them more breast milk, try to feed them more often. Or maybe they're like, oh, I want to suck on that water bottle because it looks cool. What are you sucking on, mom? What are you drinking? Like, just try to give your
I
baby a
want
little bit of water.
everything you have. I
Yeah,
want
I
it in
mean,
my
or
mouth.
like, oops, they cut my water. Oh no, I think, what the research is showing and what I've learned is that it's really pretty much like 2 ounces a day.
Very small
Water,
amounts.
very tiny amount, because their kidneys are not developed enough to handle having that much water in their system. And breast milk
Absolutely.
is really balanced just right for their kidneys.
I think about electrolytes, think about pH. Yes, if your baby's eating a lot of foods and you want to offer a sippy cup with a small amount of water just to wet their palate while
Yeah.
they're, mashing that sweet potato in their mouth, help them get used to the fine motor movement of
Mm-hmm.
moving that cup to their mouth. Awesome. But yeah, as far as physiologically, nutritionally, it's not good for babies to
Mm-mm.
have that much
So,
water.
case in point, when I was little, no one knew anything about this back then, right? I had some issues gaining weight when I was born that first week, and so my mother tried breastfeeding, and then that didn't work, so they gave me formula, and then by 6 weeks, what my mother tells me is that I was gaining too much weight.
Mm.
I was getting too fat on whatever formula they were using back then. It's a long time ago, like a long time ago now. And then they said, no, now you need to give her powdered skim milk,
Powdered. You've talked about this before. It still
right?
makes my brain hurt.
Powdered skim milk. So very, very low fat, lots of water in it.
Mm.
2 years later, I had to have my first surgery for urinary kidney issues. Then
Mm.
when I was 7, I had major surgery. Then when I was 9, I had another major surgery. And I
Wow.
continue to have high blood pressure because of all the problems that my kidneys have had. And I look back at that story once I learned more about water and kidneys and breastfeeding and baby's development, and I go, oh my gosh, was all that powdered skim milk, is that what caused my kidney problems?
Honestly, I mean, like
Probably.
that.
Really
Yeah,
likely.
really,
There's
really
no family
likely.
history of all the other issues I have with my kidneys. So
No,
it's
but I mean, there's a
really,
lot of evidence to talk
absolutely.
about kidney health and high blood pressure,
Right.
and it's yeah.
Yep.
I mean, it was funny. So my grandmother, she saves everything. My meme. We have to have her on the podcast.
I
In fact, we're
know.
gonna have her on the podcast soon. She had her first baby, my Uncle Mark, in 1959, and she brought out once, because she knows I'm an OB nurse, of course, like her box of the stuff that she had at the hospital.
So cool.
And it was like little pamphlets of like,
Mhm.
how to, if your baby is contrary was one of them, was like, a discipline, right?
Yeah.
Well, the crib card, whereas
Mhm.
now it says, hopefully, if you're breastfeeding, I'm a breastfed baby on the crib card.
Don't
But
give me
for many
pacifiers or
years,
formula.
don't give me pacifier. Many years it says just Similac or Enfamil or whatnot, right?
Mm.
My Uncle Mark's crib card said Caro's corn
Mhm.
syrup,
Mhm.
best way
Mhm.
to make infant formula. I mean, because people had to
Yep.
cook formula back then,
Yep.
right? So
Yep.
Caro's corn syrup,
Yep.
which is what you use to make pumpkin pie,
Mhm.
right?
Mhm.
Was the ingredient.
I don't put it in mine, but that's interesting.
No, but a lot of people do. Oh, pecan pie,
Wow.
maybe it's pecan
Okay.
pie
Oh, okay.
that you used to make.
Yeah. Okay.
But yeah, corn syrup, right? Was
Yeah.
like Caro's corn
Mhm.
syrup was like on the crib card.
I remember a
So-
client telling me years ago, she came to group and she stayed after, and she said, yeah, it's really challenging because I'm breastfeeding and I want to breastfeed and I'm having some struggles, but I really want to breastfeed. And my whole family, including my husband, they all drank Caro syrup formula.
Yeah.
And they are just pressuring me, why don't you just give them the formula like we did? You get some Caro syrup and whatever the ingredients are online, whatever. And she was just like, yeah, and you are all morbidly obese.
Yeah.
She's like, I love my husband, but he is obese, and his entire family who were fed this way are obese, and I don't want that for my baby. And I was like, well, the research shows that that is definitely, I mean, formula in itself, it's not every individual, but
No.
formula is
Genetics
associated
has a
with,
play.
with obesity as well. But there's lots of factors that go into it, But Caro syrup is like crazy high in sugar, and there was not a lot of ingredients in that type of formula. I've seen the recipe
No,
online
yeah,
somewhere.
right.
It was
just
very,
like corn
very simple. It
syrup.
did not meet the needs of a growing human. Let's put
It
it that
did
way.
not meet the needs of a growing baby. And that's the thing, actually, you mentioned earlier, and I think in our episode 1 about this, Ask Us Anything About Feeding, you mentioned, formula. I'm grateful to have it. Some babies need it. I wish it was better, right?
Mhm.
And you're right, because other countries, like in
Mhm.
European countries,
Mhm.
the regulations on what can be in human infant formula is
Yep.
vastly different than
Right.
in the United States.
Right.
And that's something people should know too. I really wish, and I think this is a great way to end this podcast, I really wish that instead of being formula moms versus breast milk
Mhm.
moms, right? We were, hey, if you need formula,
Yep.
let's fight to have the best,
Right.
most evidence-based, most nutritionally sound formula for
Right.
our human infant babies.
And let's fight to have more availability of donor milk
Yes.
as well for families that are interested in that.
100%. Feed our babies that way that's going to help them grow,
Mhm.
and be healthy.
Grow and thrive.
So, excellent.
Awesome. Lots of good questions. We had lots of submissions, so thank you.
And we hope you will visit babiesincommon.com/show to view all of our previous episodes and see what we have coming up as well. I know you're going to make fun of me for saying that, but we've had so many good episodes. I mean, we've had over 30 episodes, right? I mean, this was just our little quarantine project back in April.
Oh.
We've had so many great guests.
Yes. So, as always, please go to our Facebook page, Instagram, give us reviews, share this, tag your friends, make sure that everybody knows about it. If you got something out of it, let us know, let your friends know. And as always, remember, Babies in Common is a community for you because after all, we all have
Babies
in common.
Have a great day, everyone.
All right, thanks.